Lady parts are different. I had a 2nd-degree tear, so there was a tear between my vagina and bum hole.
I still pee when I laugh really hard or sneeze.
If I'm working out, okay, I'm peeing on my pants, and that's not fun.
No one tells you about some of that stuff.
Who's saying that out loud? No one was saying that to me.
Can I have a kiss?
I'm Stacy. My daughter's Lexi, and she is 14 months old. When I first realized I had some pelvic floor issues, I think I waited a little too long.
Can you give me a hug?
It wasn't until I was back to work and I was at a conference and I realized I was leaking. I'm like, I am leaking urine right now. And I shared with my staff and they were like, you need treatment.
I'm going to have you lie down on your back to begin with.
A pelvic floor is basically your undercarriage. It's all of the musculature that helps support your organs.
Engage your rear and lift up. Now pull your legs apart.
Your pelvic floor during childbirth stretches to the size of a baby's head. So your pelvic floor can become traumatized depending upon what happened during your delivery. Being a physical therapist for 22 years that dealt with postpartum issues, I would tell women what happens to their pelvic floor from all the education that I've had, but never from a personal standpoint. And when I did push my daughter out of my body, I knew at that point, wow, with women that have a vaginal delivery, this is what happens. That moment was, unbelievable. And the first thing I asked is, did I tear? And I didn't. I had a couple of stitches, but I still had to go through the healing process.
My name is Theanne, and I am the mother of 2 beautiful little girls. My oldest is Violetta. She is 22 months old, and my youngest is Leela, and she's 3 months old.
Oh, sleepy face.
It's amazing how much you can love someone that you've only known for 3 months. I realized there was something wrong with my pelvic floor 3 or so weeks postpartum. The main symptom that I was experiencing was just the feeling of something hanging in my vagina. I knew that I didn't put anything up there, so that meant that something was falling from the inside. I know. I found out that indeed I had bladder prolapse. Prolapse is when your rectum, your colon, your uterus and cervix, or your bladder fall into the vaginal canal. Very unpleasant. And the other issue that I had was diastasis recti, where the muscles in your abdominal cavities separate, and it's really destabilizing for your whole body. You don't realize how important your core is for just about everything.
Good. Let's do some cat-cow.
The number one thing people ask is, how many Kegels do I have to do in order to prevent things from happening postpartum? And that's a hard question to answer because Kegels aren't the number one thing we tend to tell people to do. There's so much more that we can do postpartum to get women to be stronger and to be functional.
Hello, how are you?
Keep control of the core. Drop 1 foot down to the floor at a time, nice and slowly.
First time I went to this class, I couldn't even do a half plank without sinking into my shoulders, and my arms were trembling because I had no core stability.
Good. Inhale, send all the way back into your squat. Press into the belt with your knees.
I have regained more core strength, and my prolapse is much more manageable now. I don't necessarily feel that sensation every day. I still get frustrated sometimes. I go through phases of like, I am woman, hear me roar. I'm fixing my stomach and I'm fixing my prolapse and my pelvic floor is going to be super strong, to like, oh man, why do I still feel this way? Is my stomach ever going to be like one cohesive sheet of muscle again? Probably not. Is my little pouch going to go away? Hopefully, but maybe not.
Let's go ahead and find your neutral spine.
Most postpartum issues are fixable. Urinary incontinence, back pain, pain with sex postpartum, all can be helped by the correct treatment.
All right. I'm just going to open up the labia and I'm going to take a look inside of Stacy's pelvic floor, and I'm going to have her go ahead and tighten up your pelvic muscles, good, and relax.
A physical therapist is doing an internal vaginal assessment. Really, we're assessing a muscle like any other muscle in the body. Does it have range of motion? Can it contract? Can it relax? And can it lengthen so that when you need it to function, can it work? It feels like a knot in my neck, but in my pelvis.
The scar tissue is definitely significantly decreased through here.
You can't push a 7-pound baby out of your vagina and think your vagina is going to look exactly like it was before. But we can get you as functional as possible where you start to get back to feeling whole again.
Perfect. Good job.
If you would have seen me 3 weeks ago, I was just like, I'm still peeing in my pants. Somebody needs to like fix me. I have so much more empathy for my patients that are postpartum.
I have my PhD in neuroscience, and not once did I ever learn what a prolapse was. And I think that's just outrageous and unacceptable. Once I got kind of the official diagnosis, then I told everybody. I told all the women I knew because I wanted them to know this could happen and that it's not normal, but it's very common. Hey, my baby. As women who bear children, we've gone through kind of a traumatic process down there, and we just need to heal it. And there's things that should be done to avoid being 50, 60, 70, however old, and having incontinence issues and peeing when you sneeze or cough or laugh. It really doesn't have to be that way.
Open to the right.
I think there is a lot of shame that comes with having pelvic floor issues. The shame really comes from people don't know that this happens, and so they think that they're one of these few people that this happens to. Why should we be ashamed? We brought this beautiful, beautiful being into the world, and our bodies suffered because of it, and that's okay. And I think that if people just start having the conversation, then the shame goes away, because you realize how many people really, at some point, will be affected by this.
Exhale, come all the way up. If you have prolapse, stay high with this.
In France, postpartum women get 10 physical therapy visits. And what they're checking for is to make sure their pelvic floor is functioning, to make sure their posture is good while they're breastfeeding, to prevent back pain. It really should be part of the standard of care here in the United States.
Here's Ivy. There's Ivy the goat. Yay!
Lexi was worth every heartburn, nausea, pushing for 4 hours. She was worth every ounce. I always say to my family, did you ever think she would be this cute?